Hey guys, thanks for tuning in today. Today's video we're going to talk a little bit about cranial adjusting and craniosacral technique. I get a lot of questions about that because I do it in pretty much all of my appointments. The most common question from the adults are, why are you pulling on my ears? So we're going to answer that today, and we're going to talk a little bit about cranial adjusting, why we do it, and what it helps with. So let's start out at the beginning. When we're babies, we all know that babies have soft spots on their head. These are called fontanelles, and these are areas where the bone of the skull is not all bone. So when babies come through the birth canal, their cranial bones actually telescope over each other, and they come down, and once they're out, they rapidly expand, and they're supposed to start going through a nice rhythmic flexion extension motion. And it's not actually just the cranial bones that are moving, it's the entire nervous system. So the brain, the spinal cord, the dura that connects to the outside of that central nervous system, connects to the cranial bones, connects to the spine, as well as to the sacrum. So there's a rhythmic motion back and forth from the sacrum and the cranial bones and throughout the nervous system. So when babies kind of come out and they're kind of cone-headed, or they have a bump on one side, little asymmetrical cranial bones, it shows that there's not a normal motion within the cranial bones, within the connective tissue, the dura that connects the nervous system to the skull. So that's where I come in. I help to align those cranial bones. I help to release the tension within the dura, that connective tissue around the nervous system, to reestablish that nice flexion, extension movement of the nervous system and the cranial bones. So that normal motion helps to spread the cerebral spinal fluid throughout the central nervous system more effectively, and that cerebral spinal fluid has nutrients and hydration for the nerves in the nervous system, so it keeps your nervous system healthy and functioning the way it's supposed to. So when there's restriction in some areas and the cerebral spinal fluid kind of gets caught up somewhere, or it doesn't really get somewhere that it needs to, then it can lead to a bunch of symptoms. People have all the time, they have different pains that they can have, or it can cause more anxiety or irritability. Any number of things can be a symptom of this dura not moving properly. This motion of the nervous system is actually called the primary respiratory mechanism. So it goes about 6 to 8 cycles per minute. It's a different kind of rhythm than your breathing or your heart rate. So when this moves properly and the dura is nice and released, then our body's going to be able to function better because our central nervous system is working better. Our body can be in a more relaxed state, a more parasympathetic state. So that's why I adjust cranial bones on adults as well as infants. It helps with infants, it helps a lot with nursing issues. I see that quite often. They kind of get stuck coming out, or they come out with a cone head, or there's different issues where their jaw's not moving properly. So I use real light pressure when I adjust cranial bones. It's about the pressure of that you would use when you test a ripe tomato. It's real gentle, and so we just kind of touch and hold the skull. It really looks like I'm not doing anything while I'm holding the skull, but it's real light pressure just to encourage that nice flexion, extension, rhythmic motion within each of the cranial bones to kind of get them back to where they should be. And as I encourage that proper motion, it helps to unwind and loosen the connective tissue, that dura that attaches from the skull to the nervous system, to the brain. So it helps to loosen that, to encourage proper motion of the whole nervous system and the whole cranial bones. So, like I said, I use very light pressure, especially with babies and newborns, because the skull is very easily moved with light pressure. The harder you go, the less it wants to move. So it's really, really light pressure. So when I adjust, I'll usually adjust the occiput. That's at the base of your skull here. This occiput, upper cervical area, is really important, especially with newborns, because that's where the brainstem is. So that's where the breathing centers and the heart rate centers are. You really want that free of restriction and inflammation. So as I adjust that and relieve any tension within the dura, make sure the occiput is moving the way it's supposed to, it helps to encourage proper brainstem function, helps to encourage proper cranial nerve function. Actually, with the upper cervical adjustments and the cranial work on the occiput, helps to stimulate the vagus nerve. So the vagus nerve comes down and innervates. It's part of your autonomic nervous system. So when it's stimulated, it activates the parasympathetic side of the autonomic nervous system. And so that's more of your rest, your digest aspect of the nervous system rather than your fight or flight. So when I stimulate that and I work on the occiput, work on your upper cervicals, it helps to have proper brainstem function, stimulate your vagus nerve so your body's calmed down, able to digest better, able to be in a better state to function and breathe. Your heart rate is improved, cardiovascular function is improved. That's usually where I start, is the occiput, because that's kind of the key to the rest of the skull, is make sure that's functioning properly. Because if the occiput is off a little bit and not moving the way it's supposed to, it can really affect the entire skull and how those bones interact. So we start there, and then I go through each of the cranial bones. I do the sphenoid bone. I usually touch here right on the side of the head to access them. And that's kind of in the middle of your head. It's where all the sinuses are associated with. It's really affected with, it really affects a lot of that central nervous system, the brain movement in the center of the head. So people with allergies, sinus issues, colds, and things like that, as I work that, a lot of times our sinuses start to drain because it's starting to allow the nerves within the skull to function better. So it helps to improve things that sinus function. And then the ears. When I pull on your ears, I pull on your baby's ears, I'm accessing the temporal bone, which is on the side of your head here. So the temporal bone kind of comes out and back in. It kind of rotates kind of like this. And it's really hard to grab onto anything else because it's right on the side. So the ears allow me to get tension in the connective tissue to start spreading those temporal bones back into a normal motion. And as I kind of pull on your ears and feel it release, that connective tissue, it helps to improve other function as well. So the connective tissue that's attached to your cranial bone is continuous with connective tissue that goes through your neck, around your arteries in your neck, down around your heart, and then down around your diaphragm. So as I release the tension within that dura and within the connective tissue, it can improve cardiovascular function, it can improve respiratory function because we're releasing connective tissue that could be restricting diaphragm motion. So I then adjust every bone in here. I do the parietals as well and kind of lift there. And then I start to work on the face with the maxilla. And with babies, I'll go in the mouth and work on the palate, work on the maxilla from the inside, and then work on the TMJ. So there's a lot of different bones in the head, and there's a lot of ways that they can kind of get restricted, especially after a traumatic event like birth. So it's really important to get your babies checked, make sure all their cranial bones are moving properly so they have proper central nervous system function as they're growing rapidly in those first couple months. But it's also really good for adults to get checked as well, especially adults who are having symptoms. It could be related to different restrictions within the cranial bone or upper cervical. People with a lot of anxiety, irritability, headaches, different symptoms, any kind of symptoms can be really related to restriction within this primary respiratory mechanism. So it's important to get checked. It's important to get everything released because, again, like I said, it activates that parasympathetic nervous system, which we just function better in that state. Our immune system functions better, our digestive system functions better, our brain functions better, our cognition works better in a parasympathetic state rather than a fight or flight state. Our cardiovascular system, respiratory system, they all work better in this parasympathetic state. So cranial adjusting is an essential part of what I do here. I do it on every client that I see. I'll at least adjust the occiput and the sphenoid and the temporal bones if I don't get to everything during an adjustment. But I also do craniosacral sessions where we work on your sacrum and we work on every single bone in your skull to help release every restriction within that dura to improve that primary respiratory mechanism throughout the body, from the sacrum all the way up the spine to the cranial bones. So I hope this video was a little bit helpful in understanding some of the reasons why we do cranial adjusting and what it helps with. Thank you very much for tuning in.